Schizophrenia. 6A20, Schizophrenia essential features. 1. At least two of the following symptoms must be present, by the individual's report or through observation by the clinician or other informants, most of the time for a period of 1 month or more. At least one of the qualifying symptoms should be from item A, through D, below. A. Persistent delusions, for example, grandiose delusions, delusions of reference, persecutory delusions. B. Persistent hallucinations, most commonly auditory, although they may be in any sensory modality. C. Disorganised thinking, formal thought disorder, for example, tangentiality and loose associations, irrelevant speech, neologisms. When severe, the person's speech may be so incoherent as to be incomprehensible, word salad. D. Experiences of influence, passivity or control, i.e., the experience that one's feelings, impulses, actions or thoughts are not generated by oneself, are being placed in one's mind or withdrawn from one's mind by others, or that one's thoughts are being broadcast to others. E. Negative symptoms such as affective flattening, allergia, paucity of speech, avolition, asociality, and anhedonia. F. Grossly disorganized behavior that impedes goal-directed activity, for example, behavior that appears bizarre or purposeless, unpredictable or inappropriate emotional responses that interferes with the ability to organize behavior. G. Psychomotor disturbances such as catatonic restlessness or agitation, posturing, waxy flexibility, negativism, mutism, or stupor. Note, if the full syndrome of catatonia is present in the context of schizophrenia, the diagnosis of catatonia associated with another mental disorder should also be assigned. 2. The symptoms are not a manifestation of another medical condition, for example, a brain tumor, and are not due to the effects of a substance or medication, for example, corticosteroids, on the central nervous system, including withdrawal effects, for example, from alcohol. Course specifiers for schizophrenia. Specifiers: whether the individual currently meets the diagnostic requirements of schizophrenia or is in partial or full remission. Course specifiers, episodic versus continuous, are also used to indicate whether the current episode is the first episode of schizophrenia, whether there have been multiple such episodes, or whether symptoms have been continuous over an extended period of time. 6A20.0, Schizophrenia, first episode. The first episode specifier should be applied when the current or most recent episode is the first manifestation of schizophrenia meeting all diagnostic requirements in terms of symptoms and duration. If there has been a previous episode of schizophrenia or schizoaffective disorder, the multiple episodes specifier should be applied. 6A20.00, Schizophrenia, first episode, currently symptomatic, all diagnostic requirements for schizophrenia in terms of symptoms and duration are currently met, or have been met within the past 1 month. There have been no previous episodes of schizophrenia or schizoaffective disorder. Note, if the duration of the episode is more than 1 year, the continuous specifier may be used instead, depending on the clinical situation. 6A20.01, Schizophrenia, first episode, in partial remission. The full diagnostic requirements for schizophrenia have not been met within the past month, but some clinically significant symptoms remain, which may or may not be associated with functional impairment. There have been no previous episodes of schizophrenia or schizoaffective disorder. Note, this category may also be used to designate the re-emergence of subthreshold symptoms of schizophrenia following an asymptomatic period in a person who has previously met the diagnostic requirements for schizophrenia. 6A20.02, Schizophrenia, first episode, in full remission. The full diagnostic requirements for schizophrenia have not been met within the past month, and no clinically significant symptoms remain. There have been no previous episodes of schizophrenia or schizoaffective disorder. 6A20.0Z, Schizophrenia, first episode, unspecified. 6A20.1, Schizophrenia, multiple episodes. The multiple episodes specifier should be applied when there has been a minimum of 2 episodes meeting all diagnostic requirements of schizophrenia or schizoaffective disorder in terms of symptoms, with a period of partial or full remission between episodes lasting at least 3 months. And the current or most recent episode is schizophrenia. Note that the 1-month duration requirement for the first episode does not necessarily need to be met for subsequent episodes. During the period of remission, the diagnostic requirements of schizophrenia are either only partially fulfilled or absent. 6A20.10 Schizophrenia, multiple episodes, currently symptomatic. 6A20.11, Schizophrenia, multiple episodes, in partial remission. 6A20.12 Schizophrenia, multiple episodes, in full remission. 6A20.1Z Schizophrenia, multiple episodes, unspecified. 6A20.2 Schizophrenia, continuous. The continuous specifier should be applied when symptoms fulfilling all diagnostic requirements of schizophrenia have been present for almost all of the course of the disorder during the person's lifetime since its first onset, with periods of subthreshold symptoms being very brief relative to the overall course. In order to apply this specifier to a first episode, the duration of schizophrenia must be at least 1 year. In that case, the continuous specifier should be applied instead of the first episode specifier. 6A20.20, Schizophrenia, continuous, currently symptomatic. 6A20.21, Schizophrenia, continuous, in partial remission. 6A20.22 Schizophrenia, continuous, in full remission. 6A20.2Z Schizophrenia, continuous, unspecified. 6A20.Y other specified episode of schizophrenia. 6A20.Z Schizophrenia, episode unspecified. Additional clinical features. The onset of schizophrenia may be acute, with serious disturbance apparent within a few days, or insidious, with a gradual development of signs and symptoms. A prodromal phase often precedes the onset of psychotic symptoms by weeks or months. The characteristic features of this phase often include loss of interest in work or social activities, neglect of personal appearance or hygiene, inversion of the sleep cycle and attenuated psychotic symptoms, accompanied by negative symptoms, anxiety/agitation or varying degrees of depressive symptoms. Schizophrenia is frequently associated with significant distress and significant impairment. However, distress and psychosocial impairment are not requirements for a diagnosis of schizophrenia. Course features. The course and onset of schizophrenia is variable. Some experience exacerbations and remission of symptoms periodically throughout their lives, others a gradual worsening of symptoms, and a smaller proportion experience complete remission of symptoms. Positive symptoms tend to diminish naturally over time, whereas negative symptoms often persist and are closely tied to poorer prognosis. Cognitive symptoms also tend to be more persistent and when present are associated with ongoing functional impairment. Early onset schizophrenia is typically associated with a poorer prognosis, whereas affective and social functioning are more likely to be preserved with later onset. Developmental presentations. Onset of fully symptomatic schizophrenia before puberty is extremely rare, and when it occurs it is often preceded by a decline in social and academic functioning, odd behaviour, and a change in affect observable during the prodromal phase. Childhood onset is also associated with a greater prevalence of delays in social, language or motor development and co-occurring disorder of intellectual development or developmental learning disorder. In children and adolescents, it may be challenging to differentiate delusions and hallucinations from more developmentally typical phenomena. For example, a monster under the child's bed, an imaginary friend, actual plausible life experiences, for example, being teased or bullied at school, and irrational or magical thinking common in childhood, for example, that thinking about something will make it happen. Among children with schizophrenia, negative symptoms, hallucinations, and disorganized thinking, including loose associations, illogical thinking, and paucity of speech, tend to be prominent features of the clinical presentation. Culture-related features. Sex and/or gender-related features. Schizophrenia is more prevalent among males. The age of onset of the first psychotic episode differs by gender, with a greater proportion of males experiencing onset in their early to mid-20s and females in their late 20s. Thanks for watching.